Well, this month, hospitals are seeing a record number of patients, and this is leading to a strain on ambulance services across the valley. Our Joe De Leon brings us more on the issue.
We're transporting patients that could be seen at doctor's offices.
Rini Perez is the director of transportation at South Texas Emergency Care. He says paramedics have received numerous calls for non-emergency cases. These calls have more patients filling up emergency rooms.
Typically, hospitals will need to utilize that emergency room, to hold those patients, and some patients may be in the emergency room for several days.
With ERs at capacity, paramedics are forced to wait for beds to transfer. That wait can be up to 2.5 hours.
Delays our ambulances as well because we have to wait for beds to open up, and so it delays the 911. On the 911 side, it delays the ambulances from responding to other emergencies.
Wesley Robinson is the chief nursing officer for the Harlingen Medical Center. He says July is typically a slow month for the healthcare center. That isn't the case this year.
This year we are finding that we are about to double the amount of patient admissions that we had last year. On average, every bed is full every single day. So we're trying to create more points of contact where people can come get health care elsewhere instead of just the emergency department.
One way to alleviate the strain on EMS staff and ERs, healthcare staff is urging to leave 911 calls for emergencies only. For non-life-threatening cases, Perez says you should wait to see your doctor.
There's many patients that are, going in for maybe a common cold or have sniffles here and that kind of thing. And you're seeing those type of patients also, taking up the room in the ERs. And right now, that's precious commodity.
Robinson says because Harlingen Medical Center has seen an influx of patients this summer, adding the facility is preparing heavily for the winter and flu season that typically comes with it.
Our planning has turned to what the winter's going to look like. If we are this full in July, then what happens when our winter Texans return to the valley, and what does it look like when winter flu and those type of things come around?
Reporting for NBC 23, I'm Joe De Leon.